Assalamualaikum warahmatullahi wabarakatuh. My name is Romi Nafriandi Anwar. I'm from Information System Department ITS, final year students. So in this afternoon, let me present about the business intelligence implementation in healthcare. So I'm from the lab of data engineering and business intelligence. So the business intelligence implementation in healthcare of my presentation is based on my thesis. So the title is the dashboard visualization and forecasting the number of dengue hemorrhagic fever cases in Malang Regency. So there is a method of the forecasting, it's called ELM, but I don't focus on the forecasting, but focusing of dashboard visualization of business intelligence implementation. So here's the outline of my presentation. There's three outlines. So the first is data and variables, so the second is dashboard, and the last is scenario. For the first one, data and variables, there are two main data that I use in the dashboard. So the first one is number of hemorrhagic fever. So this data is provided by Public Health Office, that we also known as a Dinkes of Malang Regency, from 2010 to 2019. This data is consists of variables including date, air temperature, humidity, rainfall, wind velocity, population, number of cases, average case in years, extraordinary event status, number of deaths, and number of cures. And the second data, main data, is location. This location is provided to give in dashboard geographical visualization. So it includes of three variables. There is a amount of variables that can be used. So here's the example, like population. For population, in order to do forecast, it's not really needed. So we just delete it and we use the other variables. So there is a factor why the number of hemorrhagic fever is increasing. They are the air temperature, humidity, rainfall, and wind velocity. So it's connect with the life of or life habit of the mosquitoes. So if the rainfall is high or even it's low, it will affect the life of the mosquitoes. So it's gonna be used to analytics and do forecasts with the attributes. So for the next, this is the raw data of Turen district. This is only a random number. This is not the actual data, for this demonstration only. So it has column date, and these one are the variables that I mentioned before. So it's not actually the raw data, it's already processed by the previous people who do analytics and forecasts. But the real raw data is really complicated, that there are too many attributes, that the type of data is not structured. So it's basically already processed, but it's not the final form. So here is the transformed data of the previous data. So it's only has the month column. So this data is transformed into a time series data to make it more easier to process and do forecast, and also to provide in the dashboard. So here's the supporting data and information. This dashboard is made for government, so the stakeholders or the users is targeted for government. So this is the only supporting data and information that can be helped to connect with government. So there's government strategies. I will only read the first line. So the first is control of hemorrhage transmission factor, and the next is strengthening the surveillance system for early detection, and then strengthening the diagnostic and adequate management. The last is development and utilization of vaccines. So this is what government do to prevent number of cases increasing and the death rate. And then there is key performance indicators that's not really specific, and it says that the death rate less than 1% and the number of cases is decreasing over the years. Then here is the example of the dashboard. So this dashboard was made by Bintang Setiawan, Information Systems batch 2015. He has already graduated, and because my dashboard is not finished yet, so I use his dashboard for this presentation. So this is the views of the dashboard of prediction or forecasting the cases in Malang Regency. So talking about the dashboard, who is going to use the dashboard, or we could say the user. So as I said before, that this dashboard was made for the government, and the government is the stakeholders of this dashboard. So I give the three main part of health department. They are the head of health department, disease prevention and control division, and health services division. That's the target of or the users of this dashboard, because they can make a decision or as a decision maker. So next, why I make this dashboard and for what? It's talking about the purpose of this dashboard, and it can give insight to user about trend, prediction, and movement of graphs to show the effectivity of precaution over the years. Also to make priorities among districts. As I said before, there are several government strategies to prevent and handle these cases, and this dashboard could be help the government to do other strategies and prevention based on the data and forecasting. And then next is when this dashboard can be used. Talking about the condition. So I can say that the dashboard can be used when it become a pandemic, the death rate is more than 1%, cure rate is decreasing, and under worst condition. Because when the condition is good and government can handle these cases, then the dashboard is not really effectively to be used. And then the last is how this dashboard can be used, how the user read this dashboard, and how to use this dashboard effectively. So it's talking about the decision making. They can exploring the dashboard by attributes that have been provided in dashboard. For example, is sorting the district based on highest case number. So we back to the dashboard, and I will show how to read this dashboard effectively. So in here, above here, the biggest graphs in here is the number of cases of hemorrhagic fever in every district in Malang Regency. So as we can see, in Turen district has the highest number of hemorrhagic fever, and it touched 1064. So maybe government can make a decision about this and more focus on these districts, and they can make strategies to prevent the increasing over the years. And below here is the location of health office in the Malang Regency for each district. So there's a color actually in here that shows the numbers, the rate number of high hemorrhagic fever cases. So it used the Google Maps location data, and then in here in the right there is a prediction or result of the forecasting that will be total of cases in the next year will be 1251 cases. So here's the scenario. As we can see in here, that this dashboard can tell us that almost in every first month in a year the number of cases is getting high. So I will show you this scenario. The 13th year in here, the graph is increasing. Its 13th month means the first month in the second years. And then we can see at the 37th month the graph is increasing again. 37 months, it means the first month in the third year. So in the last, this month is 49, that means the first month in the fourth years. So, and then when we break down, we can see this clearly, that the first month on the over the years that has the highest case number. So this is why dashboard can help and to see and giving insight to the users if they can read it carefully, and they could be exploring the needed of strategies to prevent the increasing of number of cases and to gain their KPI. And maybe that's all that I can present today. Thank you for listening. Assalamualaikum warahmatullahi wabarakatuh.